call the City of Franklin Board of Health meeting to order, March 14th, 2022. The only person we're missing excused is Pat Neeson. She's in Mexico, and Dr. Goldman's not here yet. So first thing on the minutes would be to approve the December minutes. We did not have a quorum for January or February, so we didn't have the minutes.
And the minutes should be in your packet from December.
Move to approve.
Second.
Any discussion? Hearing none, all in favor of approval of the December 13th, 2021 minutes, say aye.
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 Okay. And there are no citizens, so we'll skip. And is there any unfinished business? No.
Not that I know of.
Then we're going to go right into new business and to the administrative report. Personnel updates. Do we have anybody looking for the health director job?
Well, I have some general updates. So from a contact tracer perspective that I just want to briefly touch on, we're still contracting at the same number of 3 people that we were last time.
Do we still have grant for that?
We do.
Okay.
So we have the ELC funding, which goes through 2022, August 2022. And then we have some other COVID recovery money that would take us longer if needed. So we do have funding that can be manipulated in different ways to help cover the cost if we do need it. Our current plan is to have those individuals at least through spring break and see where things are at. But as you'll hear later, we are still trending down, so hopefully we'll slowly be able to decrease the amount of contact tracers needed within our department and keep on 1 or 2 people. In regards to the health officer position, the position was originally slated to close the opening last Thursday, and it's been extended until March 25th. So that was decided by administration here. And in the meantime, at the February 15th meeting, Darren Roush will be serving as our interim health officer, and he serves currently as the health officer for the city of Greenfield. So if some of you remember back to when Bill Wooker retired, he was the same individual who stepped in as the interim at that point as well.
When did Courtney vacate her?
She left the last week of February. So that
It's all news to me because
yes. So and I was going to introduce myself, which I'll do right now. I'm Lauren Gottlieb, and I work in the health department. I first started as the drug-free community coordinator with Volition Franklin. I shifted then over to the public health specialist role within our department, and have been working in those 2 roles for about 5 years. And now in January, I just started as the public health manager. So when Courtney's gone, I'm helping fill in some of the gaps in the day-to-day work in the office. And then Darren will be serving as our main interim.
Yeah, I kind of assumed she wasn't here anymore, but
Yes.
She had a baby and she wanted to stay home more, right?
Is that what it was?
Yep.
Yeah, I mean, she came back so fast after she had her baby.
And she also had a fabulous position offering at the Academy of Pediatrics. So she'll be working in that role as well.
Oh, that's
So
wonderful.
she has a lot of great stuff going on. But yes, I'm glad that you asked that question.
Yeah.
So now that Courtney's gone, as we move forward into filling that role, we'll hear more from Human Resources and our interim health officer after the 25th when the position officially closes. And per city ordinance, Board of Health is involved in that process. So if you'll remember, our chairperson of the Board of Health is a part of those interviews and decision.
Yep.
Yes, and I don't know that that's required by statute, but I think that was just a bonus
We asked
that we
her
got.
somebody and she offered.
Yeah, that was great. So we had 2
And you
Board
offered
of Health
again, I believe.
members.
Yeah, I'd love to participate again if that would
Absolutely,
be,
yeah.
that'd be great.
I'll pass that along as well.
Yep.
Yeah, please do.
And then the Board of Health, in partnership with Human Resources, makes a recommendation to the mayor, who then can bring it to the common council and or appoint an individual to the role. So more updates to come, hopefully at our next Board of Health meeting. And those are the personnel updates for now.
Okay. So, any questions? Hearing none, we'll go to community health assessment updates.
Okay, this is the survey that Courtney had introduced to you last December. Amy actually has been a part of it doing the focus groups with us, and then we've completed 21 key informant interviews as the health department, and we're trying to get a robust data set from local business partners, key informants, citizens from a wide variety of people. And we've also sent out approximately 1,000 surveys, and we got our desired sample size. So we got over 381, which we needed for a 95% confidence interval. So we're really feeling great about that. Not feeling as great about having to enter them all into the computer. So we've been doing that for over a month, and we're in the process of coding them with our epidemiologist who works 20 hours a week as a contracted employee. So we're hard at work at that. And then next steps will be to host a community meeting. And at that meeting, the goal is to have key informants and individuals who are interested in being involved in the process be able to be presented the data that's coming forth from all of these different collection methods, and then choosing the top priorities that our community in Franklin needs and wishes to focus on based on what the data is showing us. So hopefully late spring of 2022 that will be happening, and we're really excited to move forward. It's a slow moving process, but it's very, very exciting to finally be getting there. And then also included in your packet here is the 2021 Health Department report to the city. So Courtney had completed this before she left, and that's a summary of some of the efforts that we've done in 2021, and that also will be part of the assessment as we go forward.
Give everybody a minute to peruse through the folder, well, edition that Lauren gave us.
Your contact tracers are Anel, Rhonda, Debbie, Raj.
Veronica and Debbie, yep.
Anel, Raj, Debbie, okay. Making sure.
Have we done something like this in the past?
Years ago
Such
we
as
did
this
that.
book.
Yeah.
And this was also published on the City of Franklin website and then available in the Health Department for citizens.
It's a very nice report. I
It
think
is.
it's well done.
And this was in a year of pandemic. So it's also interesting to see the different types of services that have been available as things have ebbed and flowed with that.
Does anybody have any questions on this? And we'll go right into any legislative updates.
None at this time.
Oh, okay. So are there any other questions or concerns about administrative reports? If not, we'll go right into public health nursing reports and the City of Franklin's COVID updates.
Okay, the updates that we have internally are that cases are still continuing to dramatically decrease, which has been a trend now for a few months. And with the CDC's new classification of risk levels, we as Milwaukee County are in the low transmission risk. And also, just another tidbit with COVID is that we're no longer keeping vaccine on hand here at the Franklin Health Department just due to low demand. We had a batch of Moderna vaccine expiring, so that was scheduled for a pickup. And we still have channels in order if we need to order more and if the need arises or citizens seem to want that service from us. But as of right now, there's many opportunities to receive a vaccine elsewhere. And we found that this wasn't necessarily one of the sites that people were interested in utilizing anymore. And then included in your packets are some county data that is pulled together and sent to the alders and school partners every week. So that's what you'll find on the first handout that has the one graph on it on the front page. And then we have Franklin COVID specific updates that went out last week as well. So ending March 11th.
Do we have age-based vaccine data?
We do. We have age ranges, and you'll find that on the third page of the second COVID packet.
Okay.
So it'll show you the number of individuals who have received their first dose that's a Franklin resident, and then who have completed their entire vaccine series. And then we've also included in the last column there the number of people who have received a booster. So 5 to 11-year-olds, we've had a little over 1,000 people receive it. 12 to 15, 1,300, and then 16. Oh, sorry, those are only youth actually. Then the chart above goes to the total population, so the individuals who have completed both first and second dose or a series. So if they got the Janssen or Johnson & Johnson vaccine, it's 69.5 people.
So would we be able to break that down by how many in elementary school, how many in middle school, how many in high school?
And that's what's on the next
Oh,
chart down.
see.
So the second one is, no, that's okay, I was getting them confused as well. So that's the Franklin children who have received their vaccine. So then in the far left column, you'll see it broken down by age, and then it'll show their dosing.
Yeah, I saw that, but I didn't, I was, so our elementary schools go to what age? Are they till 11, age 11? Oh, okay, all right.
Or
So-
13th, 8th grade.
So 8th grade, right, for some of the private schools. For Franklin Public Schools, we're about 2/3 of our high school. This was probably when I took a peek 6 weeks ago. About 2/3 of the high school is fully vaccinated, about half of our middle school, and it was coming up at about 1/3 of our elementary school students.
Do you have an idea with preschool? And the idea of preschool,
They can't.
Well, that
have
would be
it right
5 and under, so
they
that
can't
would,
receive it.
now. Right.
So we were encouraged with that information.
I'm assuming you could, if we needed, we could correlate it back to the ages of
Sure.
infection, such. I mean, how many?
Yeah. You know, our high school fared fairly well when things were really bad compared to,
Yeah.
you know,
They're
knowing
reaching
that
herd immunity.
yeah, and we had quite a few of those students vaccinated, so
Yeah.
that was encouraging.
Okay, are there any other communicable disease referrals we need to know about?
I do not have any specific referrals, but I did pull the flu shot numbers in case anyone was interested.
Yes.
And we've delivered 825 flu shots.
We'll then move on to human service referrals. Any dog bites?
No, and that is now closed. But we have had a hoarding house that we were helping
Yes.
since the end of last year. So I wanted to provide an update on that, that now that house has been sold.
Oh.
So that case was settled. There was some court back and forth that I was not involved in, so I don't know the specific details. But I do know that that has been settled, and now the house is sold to a new owner.
Okay.
And so the situation as of right now is no more. And then one other individual that we've recently been working with a referral from our police and fire department is an individual who lives in the city who is having some difficulty with ability to care for themselves. They're diabetic and their finances are currently too high to receive support services, but there's still a struggle there. So our health department has been working to help coordinate them with family who can help or other services that will be able to provide assistance. And right now, we're currently standing by because it seems like a good plan is in place, and we're just here as a resource. So those are the two main referral
Who
cases that we
who
have.
do people contact for that kind of services?
Typically, do you mean,
Do
how do they get a
call
hold of
the health
us?
department and?
Usually it comes as a referral from police or fire. So they go out there on a 911 call or a well check call, and then they
What
make a
about an
referral.
alternate?
Do you mean if we need to check on you?
No, I'm aware of someone that might need some help.
Oh, yes. So
So-
you could call the health
Okay.
department. We have a variety of staff who work with that on a regular basis.
Carol, she,
Yes. And those are the updates I have on that.
Okay. And then what about community health?
Yes,
programs?
this is an exciting category to update because we're starting to do things, and it's really, really great to be getting back out in the community. So we have stepping on workshops happening, which we've had in the past, over the past few months even. So those are very popular, and we had a session begin on March 10th, which is filled up completely. We've also had the Mind Over Matter, Healthy Bowels, Healthy Bladder, again, backed by popular demand, which is also full. And we had a session starting in March, and we'll have one in May. So those have been phenomenally attended, and we're excited to continue to offer them. Light and Unite Red Week, many of you may be familiar with that. A couple of us have been at the proclamations in the past, but that proclamation for substance misuse awareness is happening tomorrow. So the mayor will be making a proclamation for Light and Unite Red Week, which will run the March 26th through April 1st. And that is a Milwaukee County partnership that coalitions around the area, including Volition Franklin and the Health Department, support to raise awareness for substance use and how we can prevent that in our own communities, how we can raise awareness, collect proper data, and be a resource. So people are encouraged to wear red that week. The coalition will be updating their Facebook page with events that will be happening. But a fun pinwheel project will be going on this month where the youth have assembled red pinwheels to put into the grass, location to be determined. We're thinking outside the public library to raise awareness for that week. And the Evergreen will be lighting up again with red lights that DPW is putting on tonight. And all of the electronic signs that we have partnerships with, so the school, the fire department, ours, a few businesses, will be sharing a message of prevention for the week. So it's really great to see that full community support. And then two more updates is we have the Franklin traditionally does a race, which is typically a 5K, and this year might be pivoting to a spring sprint, so a 2-mile, not actually needing to sprint, but a 2-mile run walk of sorts. That is led by the coalition Fit Franklin with the Health Department, and that is in the planning stage, so hopefully one of the first few weekends in May, and looking at potential locations right now. And then the last update I have, which I'm sure we'll have many more details at our next meeting for all of these events, but we will have the bike rodeo again this year. So that will be happening on June 4th, and that is for children who already know how to ride a bike, but it's teaching them proper road safety, bike safety, how to take care of your bike. And it happens here behind City Hall in partnership with the police department. So those are some great things.
Do you have a
that are
date for
coming.
that?
Yes, June 4th, which is a Saturday. And we're always looking for volunteers, so I'll just put the plug out there if you guys know of anyone. We have about 60 volunteer slots to fill. So it is fun to have a huge number of individuals from the Franklin Community Health, but it's very difficult to fill all those spots. So if you hear of anyone looking to get involved, send them our way.
Is that like about 5 hours, 4 hours?
It's about 4 hours. Mm-hmm.
You should reach out to Safe Kids, so I know I'm on their distribution
Yeah,
list.
that's a good
and
idea.
You have to do a number of CEUs to be a car seat technician. So that's last year's one I did, one of these rodeos.
Oh,
so
nice.
they'll send it out to their whole entire list. I think it's like 100 people.
That's a great idea.
In southeastern Wisconsin, and then they'll, because I don't know of a lot of events that are still happening, so I'm sure
No.
people will be chomping at the bit.
That's
to
a really
get
good
their
idea.
It's like one community event and then other CEUs, and then you have to do all your fittings. So.
Good, yes. So that'll be a whole course set up for that, and then helmets will be there as well. So, any questions about the programs?
They usually have a donut set up somewhere.
Oh, is that a rumor? I don't know.
A donut table.
You're
I'll
writing
ask
it?
the organizers.
No,
You worked that
I
one.
did it
Attraction.
once.
Oh, so it really did exist.
Yeah, I really did.
That's a fun addition.
For helpers. You know,
Understand. Need the fuel.
Yeah.
Nothing else under public health, we'll go into environmental health and emergency preparedness.
Okay, at the February 15th Common Council meeting, Courtney and our sanitarian went to talk about updates that were coming through our health department. So we had the council vote to amend ordinance 169-1 of the municipal code, and this was updating the health department license categories and fees. So what it included was that we're a state agent contract for our sanitarian services, so the inspections that we do out in the community for restaurants, hotels, things like that. And they struck a few things out of the contract just because it's phased out in Wisconsin. So that was one of the things. We just needed to update our local ordinance here. Also having plan review fees at 2 different levels. So that includes when people are starting to build new construction, it will need to go through a plan review process, and that will have 1 fee. And then if someone is taking a current business and then making it something else, so if a sub shop is becoming a smoothie place, it needs to go under a re-review, and I think that's the technical term, but it's another fee, a different fee structure. So it's not the same structure across the board, and our sanitarians work directly with that. So that was a part of the amendment. And then also reclassifying our department's inspection fees for mobile and temporary vendors, so a food truck, for example, to make it more in line with both neighboring municipalities, but then also taking into account staff time as we charge for those inspections. So it was changing from a one-time charge for mobile vendors and temporary vendors to a charge per inspection. So the rates slightly changed so that it's more adequate if someone's coming multiple times or just once.
So how is that gonna work now, especially with food vendors, if they are established in another municipality, but then they come into ours?
Yes.
Who does who does the inspection?
So they will have a license through the place that they're housed in. So if it's a food truck from West Allis coming to us, that's where they have the license. To my understanding, and I can clarify this, but I'm pretty positive that then our sanitarians would still have to go there the night of the event and do the inspection.
Okay.
So say it's at Target's parking lot, our sanitarians would go over there and inspect to ensure that it's safe, and then we would charge the inspection fee.
Or at the sports center there,
Yeah.
Mm-hmm.
right? And then there is a fee for our inspection.
Correct.
Okay.
And then I have one other update in regards to a vicious dog that we referenced earlier. When declaring a dog vicious, there's language from the police department and the health department that wasn't specifically aligning, so we were looking at the verbiage to ensure that regardless of where the declaration was coming from, it was the same consistent language. So the way that it was originally written included propensity to be a dangerous dog in the definition, but not further in the ordinance when you talk about the declaration. So that was changed and amended by the council by a unanimous vote. And that is the
Is there a way for citizens to complain about a vicious dog? In anything that you've seen?
Probably the police department.
I know that we've taken calls within our health department before, but a lot of it comes directly from a police report. So someone will call the police and say, I'm having this instance that a dog is being dangerous. The police will go out and investigate, make an official report, and then that's on file and either followed up with the health department or they can declare that themselves. But it doesn't jump from an instance necessarily to an immediate declaration of being a vicious
I know,
dog.
but if your neighbor knows that somebody's dog has attacked another dog in the street or something like that, and they don't call, is there a communication tool that would allow for that person at least to report it without having to, they're out there.
Yeah, other than the typical channels of calling health or police, I'm not sure, but
Okay.
that's something
Well,
to
I was
explore.
just wondering what the linkages were, or how that might be advertised as an option.
Good point.
I think you have to declare, if there's an incident, a bite or something
Yeah.
like that, you have to go through the police department and you have to say who you are.
Okay. No,
Yeah.
I was just wondering if the citizens would know how to do that. That's as
Oh.
a publication or something.
Well, that could be put into, the
Yeah.
newsletter
Yeah.
Or it could be on the website.
on the website. Yeah.
Because I've heard where that happens.
Oh, absolutely. A lot of them are never called right,
Yeah.
or they don't want to get involved.
Yeah.
Same with your question about how would you report if someone needed help? There was a person that was going down in health and not taking care of themselves. Yeah, that'd be a good thing to put on the website as well and put in a newsletter. In essence, anybody could report that. And they could report it to the health department or police or whomever they felt comfortable doing that with.
Yeah, and oftentimes if someone is feeling that way, they'll call, but having another way as a channel to share that is not a
Always
bad
good
idea.
to over-communicate.
Yeah. That's great.
And are there any environmental health referrals?
No updates at this time.
Well, this could be a record.
Oh.
Any other news anybody wants to share?
Was there ever an update? I know Courtney let us know at the February meeting, there were 2 policies that were going into question. One had to do with having the mayor appoint.
I'm glad you're asking, but I unfortunately don't have an update.
Okay,
So I
okay,
do
that's
know that the
fine.
legislature has now gone into closed session, so there was no
Okay.
movement
Why
on
don't
that
you
to the
let
best of.
everybody know what you're talking about?
Sure, and I loosely know this off the top of my head, but I can send out an email. But there was 2 drafted bills proposed, one of being in the realm of a health officer's capacity to have an extended, I don't want to misspeak because I don't know the verbiage exactly, but essentially to deal with a communicable disease and when there's a dangerous situation and make a declaration. So there was a drafted proposal on the table in regards to that, and then I'm trying to remember the other one. Which I thought, do you remember?
It really stemmed upon if the mayor had a specific term,
Oh,
4 years, then during that term, when the different department leaders would be appointed, so we have the health officer, and, other.
finance director.
Yeah, finance director, maybe the aging disability. When the mayor's term ends, then the other people's terms end as well. And then depending on that new person, then they would then decide who that new staff was gonna be, whether it was gonna stay the same or there are gonna be new people appointed. So that appointment would go along with the mayor's. But I don't think it was gonna pass, but I was just curious if it even made its way into
And
the
I don't
next.
believe so.
Okay.
I actually was digging into that this morning to try to
Yeah, I
figure
was just
out if it was
curious.
passed through
Yeah.
any.
I don't think it ever made out of committee.
No.
No, I don't think so.
And I know the ICC was against that, the
Yeah.
Intergovernmental Council for the
Yeah.
Milwaukee area was sending letters
Oh gosh, all the
opposing that because
rehiring and.
But perhaps that can be agenda item for our next Board of Health meeting. We can bring an update on where that is.
Sure.
And which house introduced it? Senate or the Assembly?
Oh,
And I
it was,
do-
I think the House. I
What,
think
the
it was the House.
Assembly?
Boy, I don't remember the number though.
But I do
Yeah.
remember the first one you spoke about.
Yeah.
That was,
Me too, yeah.
had a little bit of controversy.
I can
to it.
give you the drafted numbers because I actually just had it in my email today. Let's see here, because there is a way to look it up. Okay. So Senate Bill 1000 was the local health officer from prohibiting a local health officer from taking action exceeding 60 days, and et cetera, et cetera. And then, so Senate Bill 1000, and then draft bill LRB-1478 was another one to keep an eye on, not the one that you specifically were addressing, but there's many more details on that. And then I'm just trying to see if it states that one that you were referencing about the appointments. And it does not, but I can forward out this email from Waltham to the group.
Cool, thanks.
move to adjourn.
Is there a second?
I'll second it.
All in favor?
Aye.
Okay, this meeting is now adjourned.